until it lights up.
Okay.
And then with a minute to go, this turns yellow.
Okay.
There's up to 5 minutes for each
Yeah.
congressman, right?
Yeah.
So this is timed.
Okay.
And if you see that, you know you have 60 seconds.
Okay.
And if you doubt it, you can look right there. You see that?
But she's under 5.
Good morning. This joint oversight hearing for the Subcommittee on Oversight and Investigations and the Subcommittee on Health will now come to order. As a geriatric nurse practitioner, I'm no stranger to the challenges of hiring and staffing medical professionals, and I'd like to wish a belated Happy Nursing Week to the nurses out there. The VA has its work cut out for them. Having worked in both VA and the private sector, I know how crucial it is for patients to be supported by adequately staffed healthcare teams. Unfortunately, we are experiencing a workforce shortage nationwide, which can lead to higher risks and poor health outcomes for our patients. This crisis, which has been exacerbated by COVID-19 pandemic, an aging population, provider burnout, demographic shifts, and higher education faculty shortages, is negatively impacting all healthcare professionals, and unfortunately, VA healthcare facilities are not immune. The passage of the PACT Act last Congress, which largely expanded healthcare eligibility at the VA, makes a seamless hiring process and a robust workforce that much more important. The PACT Act also included many hiring provisions to help make VA more attractive to prospective employees and added incentives to help increase retention rates. I look forward to hearing from the VA on whether they are fully implementing these hiring authorities to address the health and resiliency of their workforce. VHA has told the committee that it is setting a record pace for hiring and is minimizing their turnover rates. In 2023, VHA's workforce grew by 9,590 employees, which is the highest growth rate we've seen in more than 20 years. This is encouraging news, but I remain concerned about the VA's lengthy and resource-intensive hiring and relocation process. Delays in hiring or relocating staff across its own system has led to well-trained and high-quality staff ending up accepting other jobs outside of the VA. I'm also worried about numerous concerns expressed by VA employees and their support organizations across the country about indifferent management, discrepancies in pay driven by poor processing, and inadequate staffing models and vacancy tracking. This isn't confined to just medical staff. Medical center police forces have been struggling with staffing issues as well. And with it being National Police Week, I want to say thank you to our VA police officers who work so hard each day to provide a safe and supportive healthcare environment to our veterans. VA police are often understaffed and must manage very difficult situations in sensitive healthcare settings. I'm introducing a bill to get to the bottom of police staffing issues and security weaknesses, which are impacting medical centers across the country, like the Hampton Medical Center next to my district. In closing, the VA appears to be making some progress, but there is still much to do. And we need to ensure the burdensome bureaucracy of VA is not reducing the quality of the workforce because it takes too long to hire, promote, or support talented employees. I hope this hearing brings clarity to what the VA is doing to minimize overlapping bureaucratic processes and what resources the VA is currently applying, as the title of this hearing mentions, to ensure a quality workforce. I look forward to hearing from all of our witnesses today about the obstacles, the opportunities they face, and the effort to ensure veterans get the care that they deserve. I especially look forward to hearing from the American Hospital Association on panel 2 to understand the lessons learned from the private sector on how they're handling recruitment and retention issues. Thank you all for being here, and I look forward to our discussion on both panels today. With that, I yield to Ranking Member Brownlee for her opening statement.
Thank you, Chairwoman Kiggins, for convening this morning's hearing. I will aim to keep my remarks brief, as I know we have a lot of witnesses to hear from today, and I'm eager to hear their perspectives. Last week marked the end of the COVID-19 public health emergency in the United States. This is an opportune time to reflect on how the pandemic affected the healthcare workforce in this country and renew our focus on addressing long-standing human capital challenges at VA. One such challenge is the complexity of VA's personnel systems. In 1946, Congress recognized the need to expedite hiring of certain VA healthcare professionals and created a new hiring authority unique to VA under Title 38. Other occupations which exist at VA and other federal agencies continue to be administered under Title V. In 1983, Congress developed a hybrid category of personnel, making certain clinical occupations subject to Title V for the purposes of leave, hours of duty, and performance appraisal, but subject to Title 38 for appointment, advancement, and pay. Thus, we have three different personnel systems under which VA occupations are categorized, each with its own set of rules and requirements. This makes the job of a human resources professional at VA a very difficult one, and VA has struggled to retain HR professionals with the skills and knowledge necessary to operate within these three complex systems. Another long-standing challenge has been VA's ability to offer salaries and financial incentives that are on par with those available to clinicians in the private sector. The COVID-19 emergency has caused many healthcare workers to leave their professions, contributing to even greater competition for an even smaller pool of potential applicants. At the same time, salaries and financial incentives in the private sector continue to rise, and VA is having difficulty keeping up. Finally, VA staffing shortages have led to increased workloads for employees who may be asked to work additional shifts or longer shifts, which contributes to burnout, low morale, and staff turnover. This is my 11th year on the Veteran Affairs Committee, and I have probably participated in at least a half a dozen hearings examining these very challenges. And what I'm going to say next is not directed exactly to the witnesses here, but it is frustrating that the VA has not made more progress addressing these challenges, most of which long predate the COVID-19 pandemic. While I am pleased that VA submitted its written testimony on time for this hearing, for the first time in a long time for the Health Subcommittee hearing, I might add, but I must say I was very disappointed in the quality of the written testimony. These are major challenges which directly affect veterans' access to their earned health care benefits, and VA's testimony, all 3.5 pages of it, provides almost no detail on the department's path forward. However, I do not believe these challenges are insurmountable. That's why I especially look forward to the testimony of today's second panel witnesses who represent a wide array of healthcare professional organizations providing perspectives from both the existing VA workforce as well as from the private sector. Together, I hope we can explore new ways in which VA can more competitively attract and retain clinical professionals. We must work together to ensure VA's healthcare system will be prepared to care for those who have borne the battle for generations to come. With that, Chairwoman, I yield back.
Thank you, Ranking Member Brownlee. I will now yield to Ranking Member Mervan for his opening remarks.
Thank you, Chairwoman. First, I would like to recognize that it is National Police Week, as the Chairwoman had. Also, I am proud to co-sponsor along with Ranking Member Brownlee of H.R. 1322, the Bipartisan Law Enforcement Officers Equity Act, which will provide equal pay and retirement benefits for all federal law enforcement officers. Our hearing today is highlighting issues of recruitment and retention, and this bill will help us recruit and retain VA police officers who often leave these positions to acquire retirement benefits. With more than 400,000 employees nationwide and the second largest budget in the federal government, VA employees are the lifeblood of the health care and benefits that we provide our veterans. Congress has provided VA with many authorities to improve recruitment and retention of healthcare professionals. As we are currently seeing at VA as well as in the private sector, recruitment and retention of clinical staff is a significant issue. Even with the enactment of the PACT Act, which has provided VA with a broad range of new authorities to aid in recruiting and retaining staff, we continue to hear that VA is experiencing issues. One major issue I've been made aware of what that impacts recruitment and retention is errors in compensation. Specifically, I am aware of issues with offers being made to employees, which are later changed when they are accepted the job. This bait and switch in salary, job description, and schedule do not imbue a sense of confidence among employees who are looking to take new positions at VA. We have also heard of VA employees receiving debt letters to recoup money they were paid due to HR coding mistakes. New VA employees are often taking positions that offer lower compensation than they would in the private sector, and these errors are a significant financial burden. I hope to address these compensation errors today. Paying our employees what they are owed shouldn't be this difficult. VA employees provide excellent care for our nation's veterans. The least we can do is pay them what they are owed. While implementation of these hiring authorities and compensation issues have proven challenging, I would also like to highlight the effect that IT modernization delays and failures have had on recruitment and retention. VA's delays with competing and awarding a new HR modernization system, along with the other administrative challenges, is a hindrance to progress. Last Congress, I co-sponsored and we passed the IT Reform Act to require better program management and acquisition controls for large IT projects at VA, and I expect to continue that oversight of this program. Veterans and employees have had enough of ineffective IT solutions, and they deserve better. I look forward to hearing from our witnesses today and discussing these and other ways to improve our ability to recruit and retain healthcare professionals at VHA. With that, I yield back.
Very much, Ranking Member Mervan. I would now like to introduce the witnesses. Joining us today from the Department of Veteran Affairs is Ms. Tracy Thrift, the Chief Human Capital Officer at the department. Accompanying Mrs. Thrift today is Ms. Jessica Bongiorni, the Chief of Human Capital Management at Veteran Health Administration. We also have Ms. Sharon Silas, the Director of Healthcare at GAO. Ms. Thrift, you are now recognized for 5 minutes to deliver your opening statement.
Good morning, Chairman Kiggins, Ranking Members Brownlee and Mervan, and members of the committee. Thank you for inviting us here today to discuss the department's hiring efforts and staffing opportunities. Joining me today is the Veterans Health Administration's Jessica Bongiorni, Chief Human Capital Management. VA has dramatically increased hiring, holding surge events to onboard staff more quickly, and increasing incentives for recruitment and retention. We are proud to report that our emphasis on hiring more competitively led to a record of more than 48,500 hires in VHA last year, and we are well on our way to exceeding that number this year. VHA's total workforce grew by 13,627 employees, 3.6% in the first 7 months of fiscal year 2023. This represents VHA's highest growth rate in more than 20 years. These efforts well position us to meet our goal of 52,000 new VHA employees this fiscal year, which would result in a growth of over 3% in the overall size of the VHA workforce. VBA was also able to increase its workforce by more than 10%, more than 2,700 employees in the first 7 months of fiscal year 2023, compared to last year with a growth rate of 3% for the same period in fiscal year 2022. VA currently stands at 439,415 employees and continues to grow each year in response to increased demand for its services, improved access and benefits, reduced wait times, improved quality, enhanced veteran satisfaction, and overall mission growth. VHA accounts for approximately 89% of VA employees, and most of the additional staffing needed in the VA in the past 5 years has been in our clinical occupations, which account for approximately 63% of VA employees. At the largest integrated healthcare delivery system in the America, VA's workforce challenges mirror those faced in private healthcare industry. Across the private healthcare sector, hospitals and ambulatory care centers have reported high turnover, increased labor costs, and increased reliance on travel nurses. While VA's turnover rate has historically been extremely competitive at below 10% annually, the rate did increase to 10.1% in fiscal year 2022, due in part to improved economy, greater competition with private sector, and the pressures and burnout of COVID-19. VA's aggressive hiring and retention efforts, together with leveraging the PACT Act authorities, have resulted in significantly improved retention so far this fiscal year, and growth leading us to a point where we are currently providing more care, more benefits to more veterans at any time in our nation's history. Despite challenges, VA's unique mission attracts new employees yearly, and nearly 30% of our workforce are veterans themselves, who identify closely with our mission. Other unique benefits attracting employees include working for a nationwide healthcare organization that provides flexibility to move to facilities in other parts of the country without leaving VA employment, while maintaining a single professional license or credential. VA benefits also include scholarships for employees to gain education in critical shortage occupations, loan repayment to help those who have already completed their education, liability protection, work schedule flexibilities, telework options, and opportunity to participate in cutting-edge medical research. VA is responding to concerns raised by customers and stakeholders about delays in hiring and onboarding processes through our candidate care model. The candidate care model is a framework and set of tools supported by customer experience principles that will assist VHA hiring managers and candidates and human resources professionals in providing a better onboarding experience. VHA has spearheaded initiatives to standardize and improve the onboarding process, including work done by VHA HR standardization teams. We've conducted an onboarding deep dive by our Veterans Experience Office and onboarding rapid process improvement workshops conducted by VHA Human Capital Management. The result is a new, modernized, and interactive onboarding experience that redesigns candidate touchpoints to fewer people across fewer systems, infused with consistent candidate-friendly messaging. To mitigate some of the hiring challenges in clinical occupations, VA continues to lead the way using telehealth and mobile deployment clinics to reach veterans living in areas defined as health professional shortage areas. VA is a leader in virtual healthcare delivery and is well positioned to expand in this area. Additionally, VA continues to use direct hire authority, recruitment and retention flexibilities and incentives, hiring initiatives, virtual trainee recruitment events, improved employee engagement, HR modernization, workforce planning, targeted recruitment of military spouses and service members transitioning from the Department of Defense, national recruiter programs for hard-to-fill occupations and specialties, and including historically underserved communities and regions. We also appreciate the close collaboration with the committee staff and look forward to continuing future legislative efforts centered especially around pay and hiring flexibilities in those critical and hard-to-fill positions. This concludes my statement. My colleague and I would be happy to answer any questions that you or members of the committee may have. Thank you.
Thank you, Mrs. Thurett. Ms. Silas, you're now recognized for 5 minutes to deliver your opening statement.
Chairwoman Miller-Meeks and Kiggins, ranking members Brownlee and Mervin, and members of the subcommittees. I am pleased to be here today to discuss our work on staffing challenges at the Veterans Health Administration. My testimony today covers recent GAO report findings and recommendations that illustrate program staffing, recruiting, and retention challenges and their impact on VHA's ability to meet its program objectives, but also opportunities for VHA to help ensure it can quickly onboard staff needed to effectively meet its mission of delivering quality, timely care to veterans. VHA operates the nation's largest healthcare system, employing more than 371,000 clinical and support staff and serving over 9 million enrolled veterans. Implementation of the PACT Act and an increasing demand for certain healthcare services, such as mental health, highlight the need for VHA to implement effective strategies for staffing, recruiting, and retaining staff. Further, it is important that VHA have the processes, data, and systems in place to ensure the agency is able to effectively expedite, track, and monitor the hiring and onboarding processes for new staff. My statement today highlights 3 recent reports. However, our findings are only examples of, in some instances, longstanding issues VHA has had in ensuring that it has enough staff to effectively meet program needs. For example, in reviews of the community care program, we cite challenges with recruitment and retention, vacancies, and the program not having enough staff to process consults to ensure timely access to care through the program. Specifically, we have an open recommendation from 2020 that leadership should assess staffing and resource needs, including strategies to adjust staff levels and address recruitment and retention challenges. In our December 2022 report on VHA's program that integrates mental health care in primary care settings, facilities often reported staffing as one of their most significant challenges to implementing or sustaining program services. Facilities cited, for example, insufficient staffing levels for providers such as psychologists and psychiatrists, turnover, and recruiting staff as affecting the implementation of these programs since at least 2016 and peaking in 2022. VA Medical Center officials told us that several factors may contribute to the program's staffing issues, including a national shortage of mental health providers, salary discrepancies with the private sector, and a slow and complicated hiring process. In our report, we made a recommendation that VHA evaluate and implement strategies to help mitigate staffing challenges that affect medical centers' abilities to integrate mental health care within those primary care settings. Lastly, I wanted to discuss VHA's hiring and onboarding processes for new hires. Although VA has undertaken a number of major modernization initiatives, including consolidating human resources within each regional network, concerns have been raised that the hiring and onboarding process can be long and complicated, creating barriers to hiring highly qualified staff to fill positions. According to VHA, the hiring process for new staff can take upwards of 3 months. In our January 2023 report, we reviewed VHA's onboarding process for new hires. We found that VHA lacked reliable data to monitor the completion of key onboarding tasks, such as credentialing and background checks, that were expedited or deferred during the COVID-19 pandemic. Consequently, VHA could not tell us the number of clinical staff hires during COVID-19 using USA Staffing, the OPM data system that VA customized to track its new employee onboarding tasks. Specifically, we found that the onboarding data was incomplete, inaccurate, and not timely because VHA lacked a comprehensive policy requiring all staff to use USA Staffing to manage key onboarding tasks and guidance to ensure consistent data entry. We made 2 recommendations to address these findings. Reliable onboarding data is important to ensuring effective monitoring of timely hiring. It allows VHA to set baselines, track trends, and measure timeliness across facilities to target where there may be pain points on the onboarding process. VHA's workforce plays a central role in transforming the agency into a high-performing organization. We placed Veterans Healthcare on GAO's high-risk list in 2015, in part based on our concern that the agency was not clear on its resource needs and allocation priorities, including the recruiting and retention of staff. VHA is taking steps to implement our recommendations. However, without continued attention to staffing challenges, including those related to its human resources modernization effort, VHA may not be best positioned to address ongoing and future demand for its healthcare services. And this concludes my statement, and I'm happy to take any questions that you have today.
Thank you, Ms. Silas. We will now proceed to questioning, and I will yield 5 minutes to myself first. Ms. Thurett, earlier this year I visited the Hampton VA Medical Center, which is just outside my district. While Hampton's made progress with medical staffing, we were shocked at the time of visit that they had been many months that they were unable to hire a police chief or deputy, which is, since it is National Police Week, it's very fitting just to start with a law enforcement question. But is this a common occurrence that the police chief and deputy positions are open? Is there anything that the VA is currently doing to improve police recruitment and retention? I know several members, including myself, are working on ways to try to incentivize that. But is there anything that the VA can do specifically before we get through the legislative process with some things we are working on?
Chairwoman Kiggins, I'm going to offer a few things that we are actively doing to support our police officer hiring processes, and then ask Ms. Bongiorni for any additional information she has. So over the last year, we have standardized a lot of our position descriptions for police officer positions. Sometimes the process for classifying a position and announcing a position and recruiting to fill it can be timely. So we're looking at every part of the process and where we can streamline, consolidate, and reduce the time it takes to engage in those efforts. We also have direct hire authority from the Office of Personnel Management for filling police officer positions. We use our non-competitive hiring authorities to bring police officers in at a faster rate than our 80-day time to hire model that the Office of Personnel Management has. And we're also exploring the special salary rates for police officers to have competitive pay in the VA when they're looking at other occupations in that hard-to-fill community. The last thing that I'll mention is we very much support the Law Enforcement Officer Equity Act. We look forward to being able to provide our police officers with those enhanced benefits as well to make us more attractive and to fill those positions. And Ms. Bongiorni, if there's anything specific to VHA that you want to add.
Thanks, Tracy. I concur with your statements, and I think we have new flexibilities with the PACT Act that are going to make it easier for us to assist on those chief positions where we did not have those same flexibilities prior to that law. So we will look at using the full scope of flexibilities with special salary rates and potentially critical skills incentives for that population.
Great, thank you. And Ms. Bongiorni, I believe that Dr. Miller-Meeks and I are some of the only people in Congress who have been through the VA hiring process as providers. And although I didn't work at the VA long, one of my primary reasons for leaving was just that it wasn't a good match. I wanted to work in a clinical setting, and I was placed in a billet that was very administrative, so I felt like my clinical skills were really being set aside. So I decided to find a different employment. But how does the VA work with current employees to match opportunities at the VA with some of their career goals? I know that especially for our nurses, we have nurses, we want to keep our nurses in all capacities, right? And the reasons that nurses leave jobs is because they are overworked and underpaid, and that they're not using the skills that they studied so hard and trained so hard to use. So I want to make their lives easier by making sure we have enough healthcare providers, but keeping the ones we have by just incorporating them in the best capacity. So is there anything that we are doing to make sure that the ones that want to keep their clinical skills current can do that? There's so many of them in different administrative roles. Is there any good matching programs where we feel like we could just do a better job at keeping them current in some of their certifications? I know that for myself as a geriatric nurse practitioner, we had such a small geriatric clinic at the Hampton VA, and which is a whole other issue. We really should be expanding geriatrics in general for focus part of care. But how are we doing this to just incentivizing keeping nurses, especially so that we can have our hands on patients, and be able to do that daily care that we love so much? But what are we doing to incentivize that?
Well, first, thank you for giving VA a shot, and when you're done with this gig, maybe you'll consider us again. So we have a lot of we have a lot of options to try to make sure that our providers are getting diversity of experience. So one of the things that we're about to test out internally is to take some of the detail opportunities that often are filled with people without maybe wide competition, and posting those in one central location so that people have access to know that there are other opportunities out there that they could test out. We are also looking to expand our continuing professional education reimbursement process beyond what we currently offer. There is some legislation pending that would help us do that, but we are going to do that internally as well. So we are very interested in making sure all of our providers have the chance to continue to improve on their education and skills.
Thank you very much. And one last question. Ms. Thurett, during the pandemic, the VA was able to expedite the hiring process to weeks instead of months with quicker onboarding. While there were several risks inherent to this emergency process, there had been some lessons learned. What improvements in the hiring process were you able to identify, and have you been able to incorporate any into your current hiring models? And just as a side note, I have a brother who's a nurse who works at the VA hospital in Maine, and I just randomly, calling him, and I chair this VA committee. Is there anything that, any complaints you have that we should be addressing? And he says, well, if you want to talk about anything at your oversight committee meeting, we have lost many physician providers just because of the length of time it's taken that. And we've gotten excited about new providers. He's in pain management clinic. And then it's taken 6+ months. So we've lost them. So that was literally the only complaint that my nurse brother at the VA hospital had. But so what are we doing to ensure that we're cutting that hiring time in half and not losing those providers?
Ms. Bongiorni and I are looking very closely at shifting from a time to hire model to a time to fill, because there are a lot of steps that need to be taken from the time a position is vacated until that next person arrives. So we're looking at what can be delayed or deferred, which is some of the approaches that we took during COVID to get folks on board faster. So re-engineering that hiring process from from vacancy incurred until the next person arrives. We're looking at what we can delay, what we can defer, what we can repurpose in terms of steps in the process, and where we can save time and streamline more of those activities. I think the ultimate goal is to be able to look at the experience that employee has. I know one idea that we have explored is instead of a tentative job offer letter and a final job offer letter, one contingent letter that tells the individual when they're going to be able to start, the things that they need to complete before they start the position, and making sure that we're working closely as a team to get all of those items completed. But I think we're looking at everything, and we welcome both the ideas of this committee as well as those on the second panel and what we can learn from private sector. Jessica, if there's other things that you are doing to streamline the process or that would be responsive to the question, feel free to add.
Sure. Well, I think we all share the same concerns. Our hiring process is more complex and lengthy than we would like it to be. So I think we've shared with this committee a detailed explanation of all of the steps that have to happen in our hiring process now. There are 83 total steps that happen in that process. 27 of them are things that we're working on doing process redesign on right now. There are also a handful, I believe 8, that require regulatory or OPM changes to make a difference, and then there are 12 that would require a legislative change. So we would love to work with the committee to figure out how we can tackle each one of those that would make the most difference.
That would be great. Thank you. Thank you very much. And so now I would like to recognize Ranking Member Brownlee for any questions she may have.
Thank you, Madam Chair. The first thing I wanted to just point out or get your feedback on is you in your opening statements and in your testimony, you talked about dramatically increasing hiring at record amounts. So I guess my question to you is, and lies some of my frustration, is that the net increase in hiring? And I presume it is not, but tell me one way or the other. Is it net?
So the growth rate is the net increase. I think the numbers that were provided were about 30,000 external hires, of which we have 13,000 net growth. So that's the net amount in terms of growth and hires.
Okay. And do you have any kind of timelines in terms of where you're trying to get to in these various categories? The chairwoman talked about public safety and police. I mean, and you talked about all these different categories.
So as part of the PACT Act implementation, we've developed a workforce dashboard. We will be releasing that, and you should see it later this month. We do have targets for this fiscal year for our mission-critical occupations, which include physicians, nurses, housekeeping aides, social workers. So we do have those targets, and we are looking each pay period at how we're doing and working towards those targets. We are seeing trends up in virtually all of those mission-critical occupations, and then VHA has also identified specialty occupations. So we are tracking that information, making sure that we are growing to the levels that we had set as targets for the end of this fiscal year, and making sure that we are on track. I know VHA is looking at 52,000 hires, external hires, so that they can meet that over 3% projected growth that they have for this fiscal year. VBA is nearing 29,000 employees, and that's about 8% growth so far this fiscal year. So
I would like to see your timelines and objectives for what you talked about, the mission-critical places. And, I applaud the VA in terms of their strong focus on implementation of the PACT Act, but we can't forget the rest of the VA and all the other missions that we have here. So I just want to get that on the record. The next question I wanted to ask is, one of the panel 2 witnesses, Mr. Morse of AMN Healthcare, observed in his testimony that VHA typically offers many of the job characteristics healthcare professionals seek, and we talk about this all the time. Set hours, generous vacation times, the security of government employment, freedom from the stress of malpractice claims and personal financial liabilities, and most importantly, a rewarding sense of mission. So my question is, what is VA doing to market these non-financial benefits of a VA career to clinical professionals? Do your offices have a marketing budget? Do the VA medical facilities have a marketing budget? I never see any marketing. I don't see it, but tell me what you're doing.
We are doing a lot, so we will connect you with all of our social media pages and make sure you're following all the VA recruitment marketing pages. We do have a national program that my office manages. VAcareers.va.gov is our central hub for all of our recruitment activities, where you can see information like our total rewards information that describes exactly what you're mentioning, the non-financial benefits of working at the VA.
So that's great, and I'm aware of those things. The problem area that I see is one has to seek that information out. They're not just going to turn on a television set or open up a magazine and see all the different possibilities. They have to seek it out. And I think, that's part of the challenge is how are we recruiting? How are we bringing, very qualified candidates into the VA? So Is there any marketing that you do that one does not have to seek the information to find it?
We do. So we also advertise our positions in places that are specifically targeted where providers are looking for jobs, so specific job boards where they might be on the hunt. We also right now are standing up a national sourcing office that will help us look for passive candidates. So people who aren't looking for jobs, instead we're going out and looking for them in a more proactive fashion.
And does this marketing include, these benefits like generous leave and liability protections and opportunities to participate in medical research, all of those things that I think a lot of people don't know that the VA offers?
Absolutely, and we do have commercials and public service announcements that are on television, but perhaps not enough saturation, so we'll continue to invest in that.
Okay. And I just wanted to, lastly, wanted to address the RAISE Act, nurses and the PAs. And the nurses have spoken to me and have told me that VA largely only implemented pay increases for employees who were already at or near the pay cap. And certainly it was Congress's intent with the RAISE Act that it would be a tide that would raise all boats. And we envisioned it to not only as a raise for those who are already maxed out, but as an opportunity for VA to reassess nurse and physician assistants' pay across the board. So what are you doing to ensure that all VA medical facilities are continually, and continuing is a key word, reassessing whether their nurse and PA salaries are keeping pace with local markets?
So thank you. We've received similar feedback and concerns raised from our nurses and our PAs. So the initial round of adjustments was exactly that, was adjusting those that were at the cap already, and then we did a review of those that were within 10% of the cap. And now we're doing ongoing reviews for those positions. We have processed hundreds and hundreds of increases in nurse locality pay schedule changes. So there are changes being made across the system. We are working through some issues with our systems, our IT systems, to make sure that we can process them timely. But we are seeing hundreds and hundreds of schedules increase across the enterprise. We're happy to provide you with that data.
Very good. It's just, I feel as though this committee has given the VA a lot of tools, and sometimes those tools are underutilized to get to the goals that we're trying to get to. Thank you. I yield back.
Thank you, Ranking Member Brownlee. I now recognize Ranking Member Mervan for any questions he may have.
Thank you, Chairwoman. Ms. Thurett mentioned in her opening statement that the VA has increased utilization of recruitment and retention incentives. Can you qualify this in some way, either in terms of dollars or numbers of employees receiving incentives? Congress provided many new authorities under the Choice Act, the VA Accountability Act, and the Mission Act, and the PACT Act, but we haven't seen any data on the extent of which the VA is using all these authorities.
Ranking Member Mervan, I mentioned the dashboard that we're developing, which you'll see at the end of the month. In terms of recruitment and retention incentive utilization, the latest report that I had seen is that we have tripled our use of recruitment incentives from last year, same time last year to this time this year, which is about 2,000 compared to about 6,000 at this point in time. With respect to the retention incentives, we've been using them in about 10,000, I think, last year, and over 20,000 this year. So we can get you that data, but we are seeing changes and increases by the authorities that we've been given and how we've been able to utilize them.
Thank you. Ms. Bajorni, Ranking Member Browning asked a specific question about marketing. And in my simple terms, very often when I have been out and about, people collect data on how they hear about them on social platforms or TV advertisements, as you mentioned. Do you have the data of the new hirees and how they hear about it, and what is the most impactful platform you are using in order to get to the most qualified candidates and those that have longevity?
Sure, we do collect that data in our entrance surveys, which we are currently revising to try to get more robust information. People do hear about us through advertising, but they're more likely to hear about us through word of mouth or that they trained at some point in a VA facility. That's the more likely path that we have people.
So if someone trains in a VA facility, what processes are in place to recruit them for permanent employment?
At local facilities, they're able to go ahead and make offers to people. One of the things that we have found is that there's often confusion about the ability to make an offer to someone who's not quite done with their training yet. So we have embarked upon a comprehensive training program for HR staff and others to make sure they understand they can make an offer that's contingent upon someone completing their full professional training. We also host trainee recruitment events that match people across the country to opportunities. If they trained at one facility but might want to work elsewhere, we match them across clinical specialties to help them find those opportunities.
What is the contributing factor that leads to that confusion?
The complexity of our personnel systems.
Please expand upon that.
Sure. It's because people normally when you post a job for federal employment, you have to meet all of the qualifications for that job before you can be considered eligible. And in the case of a clinical provider who hasn't fully completed their education, we can make them an offer contingent on them getting all of their licensure finalized. We're able to do it, it's just not what's typical in when we're doing other hiring.
Is that legislative or is that procedural that is causing that confusion about when they can make the offer?
I think it's procedural. It's a practice confusion. Yes.
Is there a way to change that practice?
Through training and education, we're trying to clarify for folks that they can make.
But has the policy changed to make the procedure easier?
There's no policy change that's required to do it. It is more of an internal practice. There's another factor that impacts this, which is that holding a position open, for example, making a job offer to someone who won't start for 1 year from now, is not typically how people make offers. As part of our higher, faster, more competitively priority action that we're working on in VHA, we're working to improve the frequency with which we recruit proactively. So before we have a vacancy, we're trying to recruit for positions before they actually are vacant and unencumbered. This is an education effort, again, to get us there.
Okay. So if there is a HR shortage or not a lot of HR employees or a reduction in that workforce, as you are bringing people on, are they being trained on that new policy in order to recruit people a year out?
Yes, so there has been a shortage in the past of HR professionals. I would not characterize it as a shortage now in VHA. We grew the HR workforce by 17% last fiscal year, and this year we are investing in our HR Star recruitment and internship program where we're hiring 1,000 new HR professionals and putting them through a year-long training program to make sure when they start in their new roles, they know exactly what they need to be doing.
Because I think what we discovered just through our dialogue is there are policies and internal practices that are in place that are contradicting the easiness in order to offer jobs to medical providers who are interning, which you had said is the major source or pipeline. So if we can eliminate that, you would think logically then we would increase the number of individuals who may be enticed to work for us. So if there's any way legislatively we can work with you to do that, please let us know.
Absolutely, will do.
With that, I yield back.
Thank you, Ranking Member Mervan. I now recognize Dr. Murphy for 5 minutes.
Thank you, Madam Chairman, and thanks, guys, for coming today. This is a big issue. It's not only a big issue for the VA, it's a national issue. I have 1 in 7 of my constituents are veterans. It's a really big number in that particular district. And PACT Act, I was going to say, didn't make anything any easier on anybody. It sure made it harder for good reasons. But again, thinking ahead, knowing this big, huge influx would occur, I think we honestly could have done a little bit better job anticipating that. But anticipation is not one of the things that Congress does very, very well. Major competition today for doctors and nurses. We saw during the pandemic that travel nurses became a disruptor, as it were. I always want people to earn as much as they can, but the fact that it did this so much in the private world, it absolutely disrupted how people pay structures. So I want to go down that alley. I think Representative Brownlee really brought up some good parts about marketing, and I'm going to get to those in just a second. But can someone answer to me how travel nurses were dealt with during that era? Because if they have to be federally employed and you have to go through this many hoops just to get them in the private world, how was that dealt with during the pandemic?
Specifically, us recruiting for travel nurses?
No, I mean, if you need nurses, you want to recruit travel nurses, but if we're talking about this absolute ridiculous bureaucracy that people have to go through to get hired by the VA, how did you guys do it during the pandemic?
A couple of different pathways. So we have our own internal travel nurse group that follows the normal hiring process that we use in VHA, but we had a focused attention on bringing them on board, especially at the beginning of the pandemic, so that we could source them out to different locations. And we were tracking what was going on with those hires every single day. We also are able to use clinical staffing contracts at the local level if we need to have a contracted nurse to provide some temporary relief when we can't staff.
This is where I'm just trying to get to. We did things well during the pandemic and cutting down the bureaucracy. There's absolutely no reason we have to go backwards and go back into embrace the bureaucracy. You know, I'm told that it takes, it's 9 months to hire somebody. And Ms. Silas, did you say something about 3 months?
Yeah.
So what's the discrepancy here? I'm not sure I understood.
It could be that the data that I'm citing is from a report that's been like 6 months since it's been released.
Okay.
So I don't know if they've made some updates.
Because I will tell you, at my institution where I work, if I hire a physician or something, getting them in the door, getting all their licensure and all that other stuff is 4 months. Why on earth would it take the VA 9 months? Why does government always have to be so much more bureaucratic? And I know you pointed out to 83 of those things. It sounds like we need to get rid of like 82 of them.
We would like to get rid of a solid number of them. So there are things that we did during the early days of the pandemic that we would like to be able to replicate. Some of those will require legislative change or continued work with our partners at other agencies to get some of the pre-employment tasks shifted to later in the process. Then there are, of course, expedited or emergency authorities we have that we always have related to credentialing, for example, but you have to be in an emergency situation to use them.
Right, well, I mean, I'm sorry, I think taking care of people, and especially with mental health patients, is an emergency, and that we're seeing an absolute explosion with mental health needs from things that occurred because of the pandemic and occurred during the pandemic, and that's not getting any worse, I mean, any better whatsoever. And the private sector is bleeding for people to come in and do mental health, especially in our kids, which hasn't affected quite the VA quite yet. I'll just reiterate Representative Brownlee's comments about marketing. Don't be a passive marketer, because when there is such a dearth of individuals, you have to be an active marketer. And I've got a lot of gray hair, I still practice, but all I hear is burnout, burnout, burnout from my fellow physicians. And with the regulation, what this government loves to pour on regulation in medicine, we're the most highly regulated industry. If you guys could reach out to the 55 and older group of physicians, don't let them retire. Don't let them go off into the blue yonder, because doctors don't do very well in retirement. Seek them out. Go into the American Urologic Society. Go into these other societies. Putting something on a board for people to seek out, it's just like checking a box. It's not being an active pursuit of people. You know, I think there is also a patriotic duty of physicians that want to serve veterans and want to do it well, but there's also just, you know, after 55, 60 years of standing up in the operating room, we get old. But going out for a VA and when trying to actively pursue individuals for all these different fields can't be passive. That's what government bureaucracy does. It's passive. You've got to be active to get those individuals. Thank you, Mr. Chairman. I'll yield back.
Thank you, Dr. Murphy. And now, Mr. DeLuzio, you have 5 minutes for your questions.
Thank you, Madam Chair. Good morning, everyone. Thank you for being here. I'll pick up on many of the good comments from my colleagues about this being Police Week and the importance to focus on law enforcement within the VA as well. My understanding of the thousands of VA police officers, roughly 90% of them are veterans themselves. In July of 2021, before this subcommittee, before my time, VA testified that granting 6C benefits, including early retirement for officers and enhanced law enforcement pension, would help with some of the VA police officer retention problems. While not within the jurisdiction here, many of us, including myself, Chair Boss, Ranking Member Takano, my colleagues here today support the Law Enforcement Officers Equity Act. Ms. Therrett, I appreciate you sharing today VA's support there as well. I'd ask if the VA's looked at granting some of these benefits to these officers administratively rather than waiting on a legislative fix.
So, Congressman, thank you for that question. Up until this point, we have had to follow the Office of Personnel Management regulations to be able to grant 6C retirement benefits. And typically that is classifying a rigorous PD, which is often our 1811 series criminal investigator positions, and then having law enforcement as a secondary. So we have individuals within the Department of Veterans Affairs today currently receiving 6C retirement benefits. It's a very small scale in terms of the numbers, because of the way we have to follow the regulation to provide those benefits to our workforce.
And so you think there isn't additional room for you to maneuver administratively short of action from Congress?
That is correct.
Okay. So hoping you could talk a bit about the specialized, unique nature of the work these VA police officers undertake related to, I'm thinking about crisis intervention training, the importance of having a special understanding of how to interact well with veterans. And again, since so many, roughly 90% or so, are veterans themselves, I would think that'd be a great benefit they bring to this work, but I'm curious how you see it.
I'll offer two thoughts and then ask Ms. Bongiorni for any input that she has. We have our Law Enforcement Training Center in Little Rock, Arkansas, and we have a very rigorous curriculum that is focused on the type of work our police officers experience in the medical centers. So I think that is one thing that helps us to stand out and, focus on the types of skills and training that our officers need. The other thing that we have talked about internally, and I know Ranking Member Brownlee mentioned this, are 3 personnel systems. Currently police officers fall under that Title V system. When you're working at a VHA medical facility, you need some of that healthcare background. You need some of that knowledge of clinical skills. So looking at better ways to both recruit and retain, if we're able to use some of those Title 38 authorities for our police officers, are things that we're exploring.
Sure, and the only other thing I would add is I think you're right on point. We do provide additional training to all of our staff about suicide prevention and their role in that, and I think that's maybe also a unique thing that our police officers need to be aware of, given how they oversee our VA campuses and the challenges that we have on them.
Okay. Thank you. Changing topics a bit here for the last little bit of time I have, thinking about some of the new PACT Act authorities that VA has. My understanding now is there's some additional authority to buy out service contracts in rural facilities, essentially in non-VA facilities, physicians, nurse anesthetists, nurse practitioners, and others in exchange for employment at VA facilities. What has the VA been doing? Has this been an effective tool? Are we utilizing it? Could more be done? Where are things within the VA there?
Well, we are excited to use the tool. We were just able to work out all the details in publishing the policy within the last 6 weeks or so. So it's rolled out to facilities. They're asking a lot of questions about how it should work, and so we will be able to report back, I think, in a few months how effective it's been. It's just rolled out.
Great. Okay, thank you. Madam Chair, I yield back.
Thank you very much, Mr. DeLuzio. I now recognize Mr. Bergman for 5 minutes.
Thank you, Madam Chairwoman. Anybody in a leadership role, and you're tasked with leading an organization, making decisions, those decisions are only going to be as good as the data you have. So any of you on the panel want to say, are you confident that the data that you have in making everything from the hiring process to the accreditation process to all of the different processes, are you again, this is like a personal opinion from each of you, is the data that you're working from accurate?
I'll offer a personal opinion. The answer is it depends. Some of our data we feel very comfortable with. So data that we report on what's going on with the number of hires and the number of employees that we have on board, we feel comfortable with. Our hiring process data needs to be improved. As GAO has found, we have many opportunities to have better tracking of what's going on in each stage of the process.
Okay, so good, because we could, and I don't want to cut you short here because time does move on, but I appreciate your answer. because I was listening in your opening statement. It says, 83 steps. I think Dr. Murphy already mentioned that. 83 steps in the VA hiring process, 12 of which are legislatively imposed. Did I get that number right?
12 of which that we think need to be changed with legislation. There are more than that were legislatively imposed.
So how many would you say of those 83 steps are currently legislatively imposed?
I would have to get back to you with that number.
Is it a big number, little? Just say big, little, medium?
Probably half, because some of them are broadly legislative or regulatory.
So we as legislators are part of the problem.
I think we have opportunities to work together to improve.
The point is that you're trying to do the right thing. We're trying to do the right thing. But if we as legislators are providing too much input, tell us, okay? Because we're going to tell you, we're trying to do the best we can, but we need the accuracy of the data so that we can say, you know what, we shouldn't be dealing with this issue because the VA leadership, under Secretary McDonough, is trying very hard from what I see, okay? But again, we're all in the same symphony here. One's the drum section, one's the woodwinds, one's the whatever it is, but we all have to play our part to get this right. So if you could take the list of requirements for a federal job and all the, to apply for a federal job, all the requirements that you have, could you take that list and X out some of them? Okay, I would like you all to just take a list of the requirements and just take a line and put them through them and give us a copy. Okay? Because they're imposed by one of two areas. They're imposed by us legislatively, or they are imposed by some good idea within the bureaucracy. And oh, by the way, I have studied and worked in and created and dismantled bureaucracies for a 50-plus year time frame. And there is a need for a good bureaucracy, but not a bureaucracy that makes its own decisions on its own criteria. You in the leadership role, us in the leadership role up here, we are the leaders. So I appreciate everything that you all are trying to do. But again, you're dealing with a Marine. My other service members, service applauded and accepted. We tend to get to the heart of the matter quickly because we want to put steel on target. In this case, we want to put people in jobs. So qualified people to serve our veterans. So with that, Madam, I yield back.
Thank you so much. I now recognize Ms. Budzinski for 5 minutes.
Thank you, Madam Chair and a ranking member. Maybe just adding on a little bit about these 80 steps and the possibility of maybe eliminating some of them. Just one of the questions when you talk about, re-engineering the hiring process, you mentioned delaying or deferring certain of these tasks. Couldn't some of the tasks actually just happen concurrently? I.e. some of those 80 steps of the process that Ms. Bongiorni mentioned, it seems like delaying or deferring those would probably do little to actually shortening the process.
Yeah, so there are many tasks that are happening concurrently. I think some of the challenges we have is there are a variety of checks that have to happen and vetting steps that have to occur that have to go through different places. Different people have to do them, and they're not centrally managed in one IT system. And so that's where in the handoff of those processes, we lose some time. I don't know, Tracy, if you want to add to that.
I was going to amplify the concurrently as a challenge because of the different offices that are involved and trying to make sure that we are all connected through the same IT system to be able to see that everything was done by that point in time. But absolutely, I think it goes to General Bergman's comment that we really need to look at what's happening at each step in the process and where we have increased the bureaucracy, the title of this hearing, reduce that bureaucracy or eliminate it completely where possible.
Okay. Great. I'm going to shift gears a little bit. A question specifically more related to my district, which is a pretty rural district in central Illinois. And, I share a lot of the concerns that my colleagues on this committee have talked about related to workforce. And I am, though, happy to see that the VHA has experienced the highest growth rate in workforce in more than 20 years. But I'm specifically wondering if this growth has been really realized in rural communities from an access standpoint. The VA often struggles to hire and retain qualified clinicians in rural areas to work in specializations such as emergency care. We talk a lot about mental health, obviously, ICUs. And for this reason, I've actually helped to lead on a bipartisan initiative called the Rural Health Core Act, which is really an attempt to help, not just when we're training medical professionals, but we've trained them, but then get them to stay in our rural communities. And if they stay for 5 years, then we help them with some of their student loan, provide some debt relief. So I understand the VHA is also working on student loan forgiveness incentives. In February 2022, Secretary McDonough unveiled funding for scholarship programs and loan forgiveness as a part of his 10 major steps in supporting VA's workforce. Additionally, the PACT Act included a provision that increased loan repayment limits, but the VA has been able to fully utilize this provision due to insufficient HR support and paperwork processing issues. So I guess my question, maybe for Ms. Thera, and then open it up to Ms. Bongiorni too, is two parts. What are some of the steps VHA is taking to recruit and retain top talent, specifically in rural areas? And then second, how will VHA improve HR support to allow for the full use of retention initiatives such as student loan forgiveness programs?
So thank you for the question. I do think this is a really critical area for us to focus on. So I can say historically, we know that our turnover in rural facilities is slightly higher than it is across the rest of the country. We saw that change during the pandemic. So while our turnover continued to go up across the nation, it actually stayed pretty flat in rural areas. So we did see 3.6% growth this year so far. In rural areas, it's slightly higher, 3.8%. It's because our turnover has stayed pretty steady. So we're improving there. We are allocating additional dollars for our recruitment marketing budget, an additional $1 million directly targeted at rural areas this year, so that we can make sure we get more information out there, more imprints, so people see what we're recruiting for. And then, of course, implementing the 2 sections of the PACT Act that really are focused on rural recruitment, the contract buyout, and then the national plan is in development right now. We expect we'll have a draft early this summer. Not due for a while, but we are working on that to make sure we're really having strategies for HR staff and hiring managers on what they really should focus on in rural areas.
Thank you. I appreciate that focus on those rural parts of our country for our veterans. I will go ahead and yield back. Thank you.
Thank you, Ms. Budzinski. Chair now recognizes Ms. Radewagen for 5 minutes.
I want to thank Chairwoman Kiggins and Miller Meeks, Ranking Members Brownlee and Mervan, for holding this hearing today. And I want to thank you, the witnesses, for being here to testify. I do appreciate joint hearings like this, and today's hearing covers a very important issue. Staffing and retention are particularly difficult in rural and remote areas like my home district, as my colleague has just mentioned. So I appreciate my colleagues for coming together to address the problem. Ms. Therrett, in 2020, a GAO report mentioned that most VA facilities did not have recommended administrative and clinical staff needed to support the community care program. What has VA since then done to address the recruitments and retention challenges for this critical function? Do you believe that veterans' access to timely care has been impacted by the staffing challenge?
Congresswoman Radewagen, I'm going to ask Ms. Bongiorni to speak on the VHA question.
Sure. So based on the feedback from the GAO report and our own review, we recognize that we need to enhance our staffing projections and models for the community care program. In particular, the position that gets the most attention is the medical support assistant. And so we have seen continued year-over-year positive growth in that position. However, challenges remain in trying to recruit for a role that is really comes in at the entry level, and our salaries are not as competitive as they need to be for those key positions. That's the first person veterans see when they come into a facility, and the first person usually they talk to on the phone. And so we are exploring new options for strengthening that position, but I think a long-term solution for us is going to be a revision to our personnel system in order to make those positions more competitive.
Ms. Silas, would you care to comment on VA's response?
I'm really very pleased to hear Ms. Bergerni's response. As I mentioned in my statement, we have been looking at the community care program for a number of years now, and even when we're not focused on the staffing resource issues, it still comes up as an issue and a concern, especially as it impacts facilities' ability to meet timeliness standards. And so we think it's a very important recommendation. It's been open since 2020, and so I'm very happy to hear VA's response to your question.
So, Ms. Silas, has GAO done any work on HR Smart and the reliability of VA's data systems that the agency uses to manage its hiring and onboarding processes?
We haven't conducted a specific audit on HR Smart. However, as part of our work on high risk, we just issued our high risk report last month, and that included information on the veterans' health care. And one of the things that the VA has done in terms of their action plan to address their high risk status is to create some goals that are related to the implementation and kind of oversight of HR Smart. So one of the examples I can provide you is that they had set up a goal to develop internal controls to ensure the accuracy of HR Smart. And then they've also developed some metrics to measure that. I mean, one of the things that we noted, the Comptroller General noted in testifying about high risk last month was that we still are looking to see some more details and specifics and more specific metrics related to the goals in the action plan. But I think this overall would be very helpful in us being able to kind of oversee and understand the progress that VA is making with not only with using HR Smart for their human resources management, but also with their HR modernization.
So I have a couple of tiny questions here I want to just squeeze in. So based on your work, does VA have sufficient and reliable data to determine whether its staffing efforts are sufficient? And does GAO have prior work evaluating VA's HR modernization efforts? And if not, would GAO consider conducting an evaluation on this topic if the subcommittee requested it?
Well, we're always happy to do additional work for the committee. We have not looked at HR modernization comprehensively, but I did in my statement talk about VA's onboarding staffing module, the USA staffing, which is part of their HR modernization effort to try to have consistent and standardized information to monitor onboarding staff. And based on that review, as I noted in my statement, we found that the data was unreliable, and that was because there was not a comprehensive policy that required all staff to use USA staffing to input information about onboarding tasks and when they were completed, and also that there wasn't a guidance for staff in terms of inputting the information and the data accurately.
Thank you, Madam Chair. Yield.
Thank you, Ms. Radowagen. On behalf of both subcommittees, I thank you all for your testimony today and for joining us. You three are now excused, and we'll wait for a moment as the second panel comes to the witness table. Thank you so much. Welcome, everyone. Thank you for your participation today. We have our second panel in place, and on our second panel, we have Ms. Kelly Sandin, the chairman of the Legislative Committee of the Nurses Organization of Veteran Affairs. We have Dr. Robin Begley, the chief executive officer of the American Association for Nursing Leadership and the chief nursing officer, senior vice president of workforce for the American Hospital Association. We have Ms. Mary Jean Burke, the first executive vice president of American Federation of Government Employees, National Veterans Affairs Council. And we have Ms. Carrie Grace, the president and chief executive officer of AMN Healthcare Services. So Ms. Sandin, you are now recognized for 5 minutes to deliver your opening statement.
Chairman Miller, Meeks, and Kiggins, ranking members Brownlee and Mervyn, and members of the subcommittees, on behalf of nearly 3,000 members of the Nurses Organization of Veteran Affairs, thank you for allowing us an opportunity to present our views on today's topics. VHA Recruitment and Retention. Is bureaucracy holding back a quality workforce? My name is Kelly Sainin. I'm a member of NOVA's Board of Directors, chairman of the Legislative Committee, and the nurse executive of White River Junction VA Healthcare System in Vermont. Our written statement has been provided. I'll discuss a few critical issues that need attention. NOVA is a professional organization for nurses employed by the Department of Veteran Affairs. The opinions provided here are not that of the VA, but of that of our members, who are nurse managers, frontline and specialty healthcare professionals taking care of our veterans at facilities around the country. I want to begin by thanking the committee for its support of the VA workforce and its work on several legislative packages that have provided the VA with various tools needed to address hiring and retention. Congressional authorities like those found in the RAISE Act, Title IX of the PACT Act provide a broad range of pay flexibility to help VHA recruit and retain quality candidates. It may be too soon to see if these will be effective in helping recruitment and retention efforts. However, we believe they can and will help. Although these authorities are generous, challenges remain as hiring delays and length of time to onboard new staff remains high. If there is one major bureaucratic challenge to emphasize, it's the VHA hiring process is antiquated and non-competitive. One issue that NOVA has highlighted in its 2023 legislative priority goals is HR modernization. It remains a centralized system that separates the staffing specialists from their customers. Without knowledge of the facility and its needs, hiring managers and others are left to do the legwork, which pulls them away from their more critical clinical duties. It's our understanding that there are supposed to be HR leaders working at every facility that help serve as a liaison between the virtual or centralized HR and the medical center. But severe shortages among HR staff, particularly HR specialists who are responsible for helping recruit, retain, and onboard employees, has led to an inability to provide quick responses or timely turnaround in many aspects of the hiring process. This leads to qualified candidates taking other positions outside of the VHA system. The private sector can tender an offer on the day of an interview. VA takes months to extend offers. They will not and cannot begin to compete when the hiring goal is 120 days. During the pandemic, VA employed expedited hiring practices, which allowed for more timely application and quicker onboarding. VA was able to hire within weeks rather than months. NOVA believes a comprehensive review of these processes should be considered, studied and used to increase efficacy and speed of hiring process. The VHA workforce needs major reform regarding pay. In many areas of the country, VA cannot compete with private sector wages. VA must be able to compete with the private sector to maintain safe staffing levels and provide the highest quality of care for veterans. NOVA members report that a balance of competitive pay and scheduling flexibility is necessary in hiring strong, committed nursing staff. As the only professional organization for nurses in the VA, we continue to monitor the department's progress in developing staffing models and position descriptions for each VHA occupation. We want to advise that an expedited VA concurrence process for handbooks and policies that require approval takes too long. Average turnaround time is approximately 18 months from initiation to concurrence. VA must be able to recruit and retain a valuable workforce without barriers to hiring that impede their ability to compete with other healthcare systems. A strong workforce is at the heart of ensuring that our nation's veterans can continue to receive the highest quality of care that they have earned and deserve. NOVA remains committed to providing that care. Thank you again for inviting us to present our views on VHA recruitment and retention. I'm happy to answer any questions that you may have.
Thank you very much. And first, I want to apologize to Mr. Morse. You are certainly not Miss Carrie Grace, so I apologize.
It's quite a compliment, though. It's quite a compliment, I might add.
Mr. Morse is the corporate vice president.
Exactly. I'm sure I'll be getting a text later.
Sorry about that.
No worries.
Corporate vice president of solution design and sales for AMN Healthcare. So, Mr. Morse, if you'd like to, you're recognized for your 5 minutes to deliver your opening statement.
Thank you so much. It's such an honor, true honor to be here today. I'd first like to thank the Honorable Dr. Miller Meeks, Chairwoman of the Committee Veterans Affairs and Subcommittee of Health, and of course, Honorable Jen Kiggins, Chairwoman of the Subcommittee of Oversight and Investigation. Thank you for this opportunity to submit our statement of record. Established in 1985, AMN Healthcare is the largest publicly traded workforce management, staffing, and technology organization in the United States, and we have had the honor of partnering with thousands of private sector, not-for-profit, and community hospitals around the country, as well as numerous VHA facilities. And before I start to comment on the VHA recruiting and retention process, I'd like to briefly talk a little bit about the healthcare staffing market conditions. Today, the healthcare workforce staffing takes place within the context of a worker shortage, and this has been endemic for us in the industry for years now. What is new is the spiking volatility in the existing workforce. The COVID-19 pandemic saw a societal shift in how workers view their relationship with employment and reassessing how and when and where they work. The resulting Great Resignation has seen hundreds of thousands of healthcare workers leave their jobs. And those worker shortages and turnover and increased competition has created one of the most competitive healthcare recruiting environments we have seen in recent memory. So many healthcare organizations are now reassessing their staffing practices to better align with the evolving market realities. And the VHA is certainly not alone in self-evaluating its ability to recruit and retain a quality workforce, and it should be commended for doing so. That said, in our work with VHA facilities, AMN Healthcare and our divisions has encountered several reoccurring challenges that have been impeded our ability to recruit medical professionals. The first and most important is the recruiting process itself. Given the current market conditions and the sense of there is a need for a sense of urgency and agility to make recruitment a success. Healthcare professionals that are recruited into the VHA are oftentimes getting multiple offers from multiple organizations. So without a really accelerated, standard, timely method of screening, interviewing, credentialing, and responding to candidates, the VHA is losing qualified candidates to more efficient systems that are in place. Furthermore, the majority of VHA facilities that we've worked with still remain hindered, as mentioned in the earlier panel, from a long process that candidates who have actually already been selected for employment go through in terms of laborious security and bureaucratic requirement gathering. That hiring process time for VHA facilities often runs as long as 6 months compared to 4 weeks in the private sector. We've also noticed strategic staffing challenges. So for example, the VHA uses temporary physicians known as locum tenens, which is a great service, but sometimes it can be overutilized and become expensive and therefore distract from actually important recruitment of perm physicians. We've noticed that sometimes the RFP and contracting process can be an additional impediment to the efficient recruiting, and once the solicitation closes, it often takes months for the contract to be awarded, and it results in candidates losing interest or the candidate pipeline evaporating. That said, healthcare facilities nationwide are adapting new technologies and methods to really streamline their recruiting process. And we know the VHA is working very hard on adopting some of those. And some of those examples we've seen in the marketplace are predictive analytics and technologies and proactive workforce planning. Advances in technology allow healthcare facilities to actually accurately project the right staffing mix between permanent and contingent labor based on patient care demand and analytics. And this helps produce a more balanced scheduling system, improved retention, integrated staffing plans while lowering labor costs. We've also seen the advent of mobile digital staffing apps such as AMN's Passport apps, which actually take artificial intelligence to automatically connect candidates to open positions to allow them to complete their application and submit to a job within minutes, if not under a day. Online automation in the form of virtual credentialing wallets and onboarding have also standardized and streamlined and reduced the credentialing and onboarding times from months to days. And ultimately, what are the employment flexibility offerings to medical professionals? The growing number of hospitals are now offering flexible arrangements such as internal agencies and internal float pools to give medical personnel a more choice and more employment options. The one important positive note, which I know Ms. Brownlee indicated earlier, is that the VHA typically does have job characteristics that are really compelling to medical professionals. Including the set hours, the generous vacation time, security and government employment, and the rewarding sense of mission that comes with helping our nation's veterans. In our experience, these features attract numerous mission-driven candidates. They're out there. But the challenge for VHA is to make their value proposition better known and to evangelize their culture to candidates. So in closing, the entire healthcare industry is putting renewed priority on addressing personnel shortages. And therefore, it's a really opportune time for the VHA to respond to these pervasive challenges. Thank you for the time. I welcome questions.
Thank you very much, Mr. Morrison. Ms. Begley, you are now recognized for 5 minutes to deliver your opening statement.
Chairwoman Kiggins, Ranking Members Brownlee and Mervan, and distinguished members of the subcommittee. I am Robin Begley, Senior Vice President of Workforce and Chief Nursing Officer at the American Hospital Association. I also serve as CEO of the American Organization for Nursing Leadership, and I'm proud to say that this week I celebrate my 46th anniversary as a nurse. On behalf of the AHA's nearly 5,000 member hospitals and health systems, I appreciate the opportunity to testify today. A qualified and engaged and diverse workforce is at the heart of America's healthcare system. Healthcare workers often say that they feel a calling to serve patients, families, and communities. We see their dedication, selflessness, bravery, and compassion every day, whether it is taking care of the sick and injured or keeping people healthy. That's never been more evident than during the past 3 years battling COVID-19. However, long building structural changes in the healthcare workforce, combined with the profound toll of the pandemic, have left hospitals and health systems facing a national staffing emergency that could jeopardize access to quality, equitable care for patients and communities. Simply put, our nation cannot maintain access to high-quality care without a strong healthcare workforce. A recent study estimated that 100,000 nurses left the workforce during the pandemic. In addition, this study showed that nearly 900,000 nurses, or 20% of the 4.5 million total registered nurses, intend or are considering leaving the workforce due to stress, burnout, and retirement. Hospitals also face similarly troubling trends for physicians and other healthcare providers and clinicians. Meanwhile, nurses, physicians, and other staff on the front lines of healthcare are experiencing deeply troubling increases in violence. To address these challenges, hospitals and health systems across the country have taken many actions. These include collaborating to expand training opportunities, launching nurse and allied health professional education programs, reimagining workforce models, investing in upskilling workers, and providing non-traditional support for healthcare workers. And I'd like to give you a few examples. Mary Washington Healthcare in Virginia partners with Germanna Community College in an Earn While You Learn program. Mary Washington onboards groups of 60 nursing students, 2 groups per year, who work 12 to 20 hours a week using a clinical rotation model. The program includes an additional nursing school as well as mentor models for nursing assistants, and they're exploring an apprenticeship model for other clinical roles as well. Pittsburgh-based Allegheny Health Network launched Work Your Way, a mobile internal staffing model to provide flexible work-life solutions for nurses, surgical techs, and others. This unique program allows health professionals the freedom and flexibility to choose how and when they can work. To fill the scores of medical assistant openings, Vanderbilt University Medical Center partnered with Nashville State Community College to train current employees, including truck drivers and environmental service staff. During training, workers continued to receive their full salary plus tuition reimbursement. Advances in technology also are driving creative solutions to workflows, workplaces, and teams. The broad adoption of telehealth is just one example how we improved where and how patients can access care. The innovative approaches that emerged during the pandemic provide an avenue to rethink care delivery, but these advances require continued regulatory flexibility and funding to continue. Finally, it's clear that our workforce challenges need immediate attention from all levels of government. Among other actions, Congress should protect healthcare workers from violence by passing the bipartisan Safety from Violence for Healthcare Employees, or SAVE Act, which would provide federal protections for healthcare workers against violence and intimidation. It would authorize much-needed funding for additional staff training, security technology, and other resources hospitals need to prevent violence and protect caregivers more effectively. Congress also should address nursing shortages by investing in nursing education and faculty, provide scholarships and loan repayment, reauthorize and increase funding for the National Health Service Corps, and increase graduate medical education slots. Thank you for this opportunity to testify. I look forward to your questions.
Thank you very much, Dr. Begley. And now, Ms. Burke, you are recognized for 5 minutes for your opening statement.
Thank you, Chairman Miller Meeks, Ranking Member Brownlee, Chairwoman Keegans, and Ranking Member Mervan, and members of the Health and Oversight and Investigations Subcommittees. Thank you for inviting AFGE to participate in today's hearing. I am MJ Burke. I am the first Vice President of AFG's National VA Council, proudly representing 291,000 of our VA employees. I'm also a practicing PT at the Indianapolis VA in Indiana, and I consider my decision to work at VA as one of the best decisions I've made professionally. VA staffing shortages remain an ongoing concern. Pay and benefits that are comparable to what competing employers provide, improved HR processes, and a reasonable workload are all necessary to attract and retain a high-caliber VA workforce. VHA has been inconsistent and non-transparent about implementing pay laws and policies designed to make clinicians' pay competitive with the private sector. Physician market pay data is no longer required to be publicly reported in the Federal Register. This has facilitated a lack of transparency for medical directors. Our members report an indefensible level of variation in market pay for physicians. Performance pay distribution has also been inconsistent. In some facilities, physician performance pay functions as an optional retention bonus or award rather than what it is. It's salary for those who meet the requirements. Third-party locality surveys for registered nurses and physician assistants are not being executed transparently. Locality pay surveys should be triggered by factors such as turnover rates, resignations, and vacancies. But the inability to obtain information needed to calculate timely turnover, vacancy rates makes it hard to determine whether the agency is being compliant. Widespread human resource errors create further barriers to retention and recruitment and tarnish VA's reputation as a good faith employer. People accept job offers based on salaries, job duties, and schedules outlined in offer letters. When these differ from offer letters and realities, it's an injustice. These individuals may have given notice at previous job, declined competing offers, relocated based on erroneous HR offers. To make matters worse, these employees can be hit with debt letters, meaning the department will claw back money. Congressional oversight is needed. VA needs better training and HR coding within the department. 38 U.S.C. 7422, which disallows employees from using grievance procedures from a collective bargaining agreement for issues related to compensations, limits redress for many of these problems, citing the inability to grieve compensation under 7422 as a complete bar for obtaining information about locality pay surveys mandated under 38 U.S.C. 7451 is not helpful. Finally, VA staffing shortages are driving longer hours for clinicians, unworkable bookable hours standards, too many patients, and unpredictable shifts and days off will not help recruitment and retention efforts. To fix these problems, AFGE recommends VHA provide HR officials with proper training to code VHA personnel records and mandate after-action plans for errors. VHA should make third-party locality pay surveys more accessible to employee representatives. Employee representatives should receive the same training a locality pay survey as managers receive. Congress should enact H.R. 543, CPE Modernization Act, which passed the committee last Congress in a bipartisan vote, would increase the eligibility for clinicians to receive CPE, increase the reimbursement amount, and adjust the amount for inflation. Employee representatives need access to routine information about nursing hours per patient day, turnover rates, vacancy, and the maximum number of people to be allowed for a specific unit. We should not have to file grievances or information requests to get this critical information. VA should regularly report information about VA specialties that conduct physician market pay evaluations and include whether the adjustment was made. VHA should change scheduling policies so that they are sustainable. VHA should develop staffing requirement for high-risk individuals with service-connected mental health problems. The length of time and frequency for follow-up visits needs congressional oversight. Congress should amend 7422 to allow full collective bargaining rights for Title 38, including the ability to grieve VA's own violation of pay policies. Congress should pass H.R. 1322, the LEO Act, to give VA police full law enforcement benefits. Thank you for giving me the opportunity to testify at today's hearing, and I look forward to answering any of the questions you may have.
Thank you so much, Ms. Burke, and I yield to myself for 5 minutes for questions. Mr. Morse, you mentioned things like flexibility for employees, and some of you talked about work-life solutions, and just thinking back to when I was looking at jobs at the VA, I mean, are we offering those flexible solutions? I think of especially military spouses who want to work, and or veterans, any candidate really. I mean, there's a lot of moms and dads that have children. They want part-time options. They want those flexible ways. There wasn't a lot my job at the VA was the first time I worked full-time as a nurse practitioner. I had 4 children and a husband that was deployed a lot. So for me, it was a real challenge, and that was a factor and a reason I didn't stay with the VA. I would have loved to switch to a part-time option. They weren't out there, that work-life balance, those flexible options. From my limited experience, I don't feel like the VA is doing a great job. Ms. Sandin, can you speak on behalf of your organization and tell me if you think that the VA is doing a good job of offering those flexible solutions, or do we need to do something from our end to improve that?
Thank you for the question. It's an excellent question that we've discussed often as our membership. I would say that it's very inconsistent. So some reports where these flexibilities are well employed, and then some other sites that aren't necessarily using those flexibilities. So that's, in a nutshell, it's just inconsistent across the nation from our members' perspective.
What can we do, or what types of flexibility solutions would improve our recruitment and retention of nurses specifically, but all employees?
Specific to nursing, we have really focused in on the 72 for 80. So essentially, nurses will work 72 hours and get paid for 80, which is what our competitors are doing in healthcare. And this is something that we would definitely need some support for. It's in the written testimony that was submitted, specific to making that be a standard pay mechanism. Right now, there isn't one. There's many hoops that have to be jumped through in order to get that 72 for 80. So it's not that it's not available to us. It is available to us currently, but it's just not well utilized across the nation from our members' perspective.
Mr. Morse, do you have anything to add?
Yeah, it's a great question. And I don't think the VA is alone in healthcare systems evaluating the different ways that employees are looking at working and wanting to work with healthcare systems. And so this question is being asked across all healthcare systems. Agreed, there is a need for more flexibility, and I agree with the comment that there's inconsistencies in application of that. That said, we are seeing the advent of a lot of different sorts of both technologies and work arrangements that allow for health systems to identify different types of pools of talent that they may want to approach and look at working in a part-time capacity. So for example, I mentioned internal float pools, and I think someone in the prior panel had mentioned internal travel agencies. There's a huge opportunity to take the skill sets, if they're standardized, and the requirements, and allow workers to have the flexibility to move and mobilize across the different visits and the different VA facilities. But those inconsistencies and lacks of standards can really demobilize that, and that's speaking to a certain type of worker base that would like to do that. On the flexibility of part-time, we can curate float pools that allow for things like you just said in terms of just part-time work, or maybe there's second medalists, people that interviewed that were great runners-up but didn't get the particular role that we can curate, or retiree groups that we can curate through the technology to keep them engaged and keep them active and thinking around that. So there are different types of technologies and ways to curate that, but you have to have a consistent governance policy and kind of identified way of managing that and identifying those pools. I hope that helps.
Great. Yeah, it does. Thank you very much. And Dr. Begley, in your testimony, you cited a survey conducted during the pandemic where 44% of nurses reported experiencing physical violence in the workplace. 68% reported verbal abuse. These statistics are appalling. And in your view, do they reflect the experience of clinicians at VA hospitals today? And you mentioned the SAVE Act, but what else can we do, or what else can you recommend to address this increased hostility that medical providers, especially nurses, are facing?
Thank you for your question. It really, truly is probably the #1 comment that I receive from nurse leaders as I, travel the country and interact with my colleagues. Hospitals and health systems are doing everything they can to mitigate violence. They have safety plans for their organizations. I think the need to really focus training for all employees, not just clinicians, is really important, and that's what we are seeing throughout the country. In addition, there are technologies in the way of safety panic buttons and metal detectors that are subtle and not very overt, but really help protect our patients and our staff. I mentioned the SAVE Act in my statement. I think it's really important that, our public, our patients, that we're here to serve them in their most, in their not so great times. They have real challenges when people are in the hospital and receiving our services. We know that it is challenging for them, and we're trained for that. We're trained to de-escalate conditions, but there also is, the SAVE Act would really recognize that our workers are here for the public trust. I mentioned that it is a calling to many of us in healthcare, and I think that would be a really significant federal statement that it is just unacceptable to be violent, whether it's verbal or physical. And so, we are studying ways that will help mitigate intentional violence, and I think that's really something that there's future work to be done on, to really evaluate why we are seeing the rise in violence across the country in our hospitals and health systems.
Thank you. I appreciate that. And now I'd like to yield to Ranking Member Brownlee for her 5 minutes of questions.
Thank you, Madam Chair. Ms. Burke, thank you for being here and your testimony today. Just to follow up on the conversation we're having here, can you kind of reflect, do you hear from a lot of your members with regards to acts of violence towards women in the workplace?
We do, but I want to say that VA is probably the most proactive in this regard. We have something called the DBRS, which is the Disruptive Behavior Reporting System. And so when there's an act of violence, patient against employee, or even employee perceived against employee, there's a group that gets together and they potentially flag that veterans chart, and sometimes it's called behavioral restraint. And so, for example, one of the challenges I think that we are really struggling as an organization is the vast outpatient situation where VA police, which if they were at what we call the mothership, the main medical campus, would be present for some of those behavioral restraints. In CBOCs, that's not so much the case. And so like in your district, California, where we have extremely large geographical regions, lots of CBOCs, we have heard complaints where the local municipality may not understand the grievance, the amount of concern there regarding safety. So I think we need to do a little bit better in addressing safety plans, especially with our CBOCs, and creating some policy around that.
Thank you. And in your testimony, you talked about transparency or lack thereof. And you've talked about this omissions and errors that are occurring. We don't really have any data on that, so that's frustrating that we don't, we don't have that data from the VA. But can you just give me a sense in terms of where you work and the members that you were representing, et cetera? Like, how many of these, omissions and errors are occurring?
Yeah, I think that's a great question, Congressman. Thank you for asking it. A lot of times I consider, if I hear it in my location in Indiana, that's kind of like the middle of the bell-shaped curve as far as the population we serve. So you can only imagine what's going on in California, Nevada, North Carolina, Texas, where we have growth of our population, very full panels, et cetera. Just like in the last 2 months in my location, I've had at least 4 job offers or 4 complaints where they are saying what they offered upon initial coming on hiring or an offer of potentially another job assignment ended up being like, oh, I'm sorry, we made a mistake here. And I think it goes to other people that have testified here. There are so few candidates that has to be like 100% accurate. I mean, we're at that point where they just have to be accurate, and we need job letters that are commitments to these tentative employees. Not only a timeliness thing, but we have issues where if you're not going to be in the marketplace leader, you rely on your mission and you rely on your conditions of employment. And they have to know what those are. And we have to be not tarnishing the VA reputations when those are wrong.
So are you saying that, just as an example, that the VA hires someone at $100,000, they move from one place to another, they arrive at their new job, they've moved, they've gotten an apartment, a place to live, and then the VA tells them, I'm sorry, we made a mistake. You're actually getting paid $80,000.
Yes.
Is that?
Yes, exactly.
That's it exactly.
Exactly.
And then what happens?
The HR person turns and said, I'm sorry, it was a tentative offer. And therefore we
But does the
can't-
VA take responsibility and say, it's our error, so we're going to pay you $100?
No.
No. And so do they say that you're going to have to give us?
Right, and even our ability to grieve that, because there's not what we want is like a job offer, and our ability to grieve those like salary disturbances, those things that aren't right, we can't do because, the agency often uses this exemption of 7422 from the collective bargaining agreement. So there's no way to adjudicate these problems either. So that's, why we're advocating at least for these compensation rules and VA's policies, potentially in violation of VA policy or the law. We need to have some oversight with that through the collective bargaining agreement.
Thank you. I see my time is up. I'll yield back.
Thank you, Ranking Member Brownlee. And now I recognize Ranking Member Mervan for his questions.
Ms. Burke, one of the most frequent frustration expressed by VA medical center staff, whether we are speaking to facility leaders, service line managers, union leaders, or frontline staff, is they no longer have as much access to HR professionals as they once did. As a result of the VA's ongoing HR modernization effort, what have been some of the negative effects of this reorganization, and do you think leaders at the VA central office are doing enough to address the concerns about these unintended consequences?
Thank you, Congressman, for the questions. I think the main problem is if you can't get a human on the line, it creates frustration to answer anybody's questions. I guess I'm a little bit old school. I'm trying to figure out what problem HR centralization is supposed to fix. And so as a result, when you have consistent HR shifting around, no one likes generic email boxes. I know the point of contacts are a SharePoint somewhere, but every facility has a different intranet, so you don't know necessarily how to get a hold of, who to get a hold of. And when there's questions about pay, questions about childcare subsidy, the interpretation of HR policy. A lot of times these lower level people don't know who to turn to exactly. I do think the people that you heard from the first panel are working their issues, and they are hard workers, I will say that. But I think at times the training programs specifically involved in HR coding, I don't see an after-action loop connected to those coders, and I think that's a big problem.
Ms. Burke, you discuss in your testimony a lack of transparency about whether VA medical facilities are appropriately assessing market pay for physicians and locality pay for nurses. From your perspective, what could Congress do to promote better transparency in setting market pay for locality pay?
The VA needs to follow their own regulations and the law for sharing results with employee representatives regarding locality pay survey data. 7451 of the law provides for timelines for directors and the Undersecretary of Health to enact results for locality pay surveys, which are basically the RN and PA piece. And it's hard to see through that process when you're not given routine access to turnover, what authorized ceilings are for vacancies, what the vacancy rate is, what you're trying to recruit at the given time, unless you go to USA Staffing. So some of this is internal things on step one before you can get to step two of assuring that when they get the data back, they have 30 days to make a decision and within one pay period to enact. We have trouble getting to those points because we can't see through that process very well. So the market pays for physicians, I think the panel before that and our other panelists here it's just not a VA problem. It's a private sector. We have fewer candidates. We're not going to be the market pay leaders. And so issues with VA following their own policies, when you have anesthesiologists complaining that I'm a board certified person, I've been here for 10 years, and a resident that just came off his fellowship is making a lot more money than me. Those are market pay policies that are not consistent. And especially in our areas of primary care, and especially our areas of psychology and our psychiatrists, that needs oversight with, I think. And I think we're at the point where we just need 7422 to allow us to have access to better data to assure that VA follows their own regulations in that regard, sir.
Okay, with that, I yield back my time, Chairwoman.
Thank you, Ranking Member Mervan. And now the chair recognizes Mr. Bergman for 5 minutes.
Thank you, Madam Chair. First of all, Dr. Begley, let me say congratulations. You noted this is your 46th anniversary as a nurse. Did I get that right?
That's correct.
You kind of struck a very positive nerve for me because my oldest daughter, who was born on Father's Day in 1971, announced at the ripe old age of 16 at one point that she was going to be a nurse. And now some 35 plus years later, she is still in nursing. She chose pediatrics rather than geriatrics, so she told me I was out of luck for that. So she said she was going to assign her younger sister to care for me in my older years. But the point is, as we look at what you all do and what you're trying to do, you are to be commended. So I'm going to, again, as a Marine, life's pretty simple for me. Get a mission, get the training, get what you need, and then go do it. Were you all sitting in here during the first panel? Okay, and we talked about the 80-some steps, and could you cross out some of those steps necessarily? Do you think, and I say this to all four of you sitting there, do you think if you had that same list of steps that you could kind of line out some of the things that would maybe make the interactions better across the board?
Well, I'd like to begin and thank you. My daughter's a nurse practitioner, and I'm very proud of her, and she's the one who's stuck with me in my old age. I think in the private sector that, we have the same challenges. Maybe not the numbers of steps, but every hospital and health system that I know of that is, that are part of our membership, they're looking at ways to compress that time frame. We need to hire more folks in a timely manner, but also, of course, very safely. Some of the challenges, I think, that we experience that are not perhaps something that the VA experiences is that we have individual state boards of nursing, medicine, et cetera, that can vary in their requirements and even timelines for what, when we need to access information from them. But,
can I interrupt for a
Sure.
second? Because you made a point there I want to piggyback on. So what I heard you say is state boards of licensing play a role?
Yes.
I just want to make sure.
Yes.
So the thing we've been dealing with, in this case, I sit on armed services as well, and this is kind of back when I had my hat on as a military commander, the licensing across state lines when members of the military would get transferred from base to base and now their spouse couldn't work, as whatever it is, nursing assistant, registered nurse, whatever it happens to be. So, and I guess I want to ask you, just kind of dig into that a little more. Is there things out of our control here based on what the states do that matter, no matter how hard we as Congress and, the Veterans Administration do, that states can still screw it up for us?
Well, from a private sector perspective, I'd say that there's definitely variation in sometimes even just the timing of information back and forth, the information flow from state to state. And they do, the states are, responsible for the licensure for the individuals in their state. Now, we know that in nursing, for example, we have what's called the compact licensure, which allows a nurse from New Jersey, like me, who has my license in New Jersey, to, go to Philadelphia, for example, and work, or other states that participate in the compact. I don't know if that was a great example, because I'm not 100% sure that Pennsylvania participates, but there's now about 40 states that have this compact agreement, which really helps because, if you live close to it's an economic issue if you have to maintain licensure in a number of states. It's also a convenience factor for if I have a job, if I live in New Jersey but live by the border and want to travel across state lines to work in other places, it reduces, it reduces red tape for sure.
Well, and I know my time's running out here, but that's something. That's why we have these hearings, so we can see what are we missing, if you will, when we get thinking about a certain issue, whatever. But just thank you for that perspective. You gave me something to work on now, Madam Chairman. I yield back.
Thank you very much. And the chair now recognizes Ms. Budzinski for 5 minutes.
Thank you very much, Madam Chair, and thank you to the panelists. My first question is for Dr. Begley. As I know you're aware, we've been discussing our rural hospitals and facilities, including those in my district, are struggling to recruit and retain staff. Many factors contribute to this, including staff burnout, inadequate pay, and burnout, many experienced due to the pandemic itself. So my first question is really to address this problem. I know AHA has supported several recruitment initiatives, such as the National Health Service Corps, which I think you've referenced, which is similar to the efforts I'm also pursuing with my that I'm co-leading on the Rural America Health Corps Act. Could you talk about how robust funding of workforce development initiatives, such as loan forgiveness, could make a difference in rural veteran spaces?
Well, it's a little bit hard for me to comment on veteran spaces, but from a rural perspective, loan forgiveness, we know that there's from even our own employees in hospitals that are frontline employees in more entry-level positions would make fabulous clinicians, would make wonderful nurses, but they don't have the resources to not work and to pursue, their nursing degree or even a nursing tech degree, or a certification. So the funding that would allow the education and training to occur would go, I think, just light years ahead to be able to take these very competent and individuals that have real potential and help them realize their dreams. In particular, rural folks, and we have, in the HA, we have the rural committee. We also, in nursing, have the rural nursing leadership group. And rural folks tend to stay in their homes, but in their home district, but we have to really enable that. So I think that the funding would be very helpful. And I just want to add a note that, partnerships, academic practice partnerships, so hospitals are actively reaching out to their community colleges, to their local universities, and not just the once a year, how many clinical, spots do you have, how can we fill that, but really doing planning for the future and saying that in this year we'll need approximately X amount of nurses, of other clinicians. And what we've been seeing across the country is that hospitals are saying, I have masters and in some cases doctorally prepared nurses and other clinicians, and we're going to loan them. It will be a joint faculty agreement so that we will pay our nurses to go and teach in your facilities, and this is, or your organizations, your colleges, and this is really a wonderful model for the future as well.
Okay, thank you very much. I just had another question more related to competitive compensation for healthcare professionals, and I really appreciated Mrs. Burke's testimony, and you kind of outlined, I think, a lot of different steps that we could be taking. Maybe I could open this up to Ms. Sinden as well regarding competitive compensation, and just from your perspective, what would you maybe highlight are some steps that VHA can take to improve competitiveness and transparency and pay to attract talent to our rural VA hospitals?
Thank you for the question. Our members have voiced that we feel more transparency, as one of my colleagues over here had just previously mentioned, regarding the annual market assessments, the third-party process, which seems to be time intense, and then the implementation of said evaluations and changes in pay salaries are too time intense, and we end up lagging our competitors, so we lose qualified candidates. So becoming a more competitive agency, keeping up with our salaries is one good strategy to really employ, and that's really what we feel would be the best bang for our buck.
Most effective. Yeah. Okay, thank you. Thank you so much. I'll yield back. Thank you.
Thank you very much. The chair now recognizes Mr. Rosendale for 5 minutes.
Thank you very much, Madam Chair. Ms. Begley, I appreciate you talking about the compacts. I represent Montana. We have a very, very large veterans population, 10% of our population, and we started working on compacts and the reciprocity 10 years ago. And so I'm glad to hear that there's 40 states. It makes the family easier to relocate and much happier once they get there. So it is a good thing, and I would say that if there's any states out there listening that haven't joined in, that they should do so. My questions, though, are for Ms. Burke. Ms. Burke, thank you for testifying today. You state in your testimony, and I quote, prospective employees accept VA offers based on salaries, duties, and schedules outlined in tentative offer letters. When they report to the job, they are informed by HR or their manager that their salary, job description, or schedule differs from the offer made by the VA. This is unacceptable. There is no one in the private world that would be exposed to that and expect to keep any kind of a labor force in place. Employees should know what their job description will be when they accept a position. How common is this practice?
Thank you for your question, Congressman. I can only give you anecdotal references. At the beginning of the pandemic, when it was just like fast and furious retention allowances being given to everywhere. A lot of our nurses, especially in those 24/7 operations, being picked up and moved because it was just such a turbulent time for hiring. We had, the ones I'm aware of, we had locally like 21 retention service agreements that were in error. And so basically those service agreements were lengthened as a result of that. That was fixed by the PACT Act. But to give reference, I believe all 20 of those people have left that situation.
Which leads me to my next question. How does that hurt employee morale and/or retention?
I think it creates, I always look at things kind of very simply, and if you can't be a market pay leader, what you're dealing with is the mission of what we do and the conditions of employment and the predictability of what we have to offer. And so consequently, it erodes trust at the bottom line. And so it's not really, I think, sometimes the trust of that frontline supervisor as much as of it is potentially the offer was made and it was based on a specialty schedule that wasn't right, and they thought they were coming to get that specialty schedule, and it
Okay,
was...
so what ideas do you have to prevent this in the future?
My ideas are pretty simple. You have to have a written job offer. And it has to outline maybe the functional statement that's attached to it, a salary, not a range, and not a salary range, a salary offer, your hours of work, and any variability that may occur as a result.
So much like what we do or do not do up here, and that is to be more precise about exactly what you expect.
Yes.
Okay. We've heard a lot in this hearing about hiring and onboarding timeliness issues at the VA. There's a legitimate concern that the VA is taking much too long to hire and onboard employees, resulting in the VA losing good employees who have other offers. It's unacceptable as it results in worse care for veterans who visit the VA. How long on average, from your experience, does the hiring and onboarding process take for a VA job?
I think the ideal scenario is, I think they're down to 80 days. I think the question really is when do you start? For me, from my perspective, when do you start the stopwatch for that 80 days? I don't think it's just merely, sir, this is my perspective, an issue with a timeliness. It's when they're allowed to fund those positions. And so this gets back to the Mission Act 502 requirements specifically. If the Congressman Bergman was here, what you hear from DOD and HR particularly is they're used to manning documents to execute the mission.
Right.
Okay? We don't really have that.
How does that compare then with, if it's 80 days, how does that compare with other agencies? And how does that compare with the private sector outside?
I don't think it's where we should be yet. We need better processes altogether. I think we need staffing requirements to be outlined, kind of transparent. If you have X amount, I can only tell you what I think, which is if you have X amount of high-risk suicidal patients, how many psychologists or mental health professionals you need to execute that treatment plan for those patients. That's what I feel.
Okay. And Madam Chair, I see that I have run out of time, so I would thank you for your, answers, and I yield back.
Thank you, Mr. Rosendale. The chair now recognizes Mr. Pappas for 5 minutes.
Thanks very much, Madam Chair, and thank you to our panel. And Dr. Begley, I want to congratulate you as well on 46 years in nursing. But thanks to everyone here for their professional accomplishments and their contributions to the discussion here today about how we can support our healthcare workforce at VA and writ large across the country. I want to delve into an issue that has become readily apparent. In New Hampshire, where I'm from, we have been talking about a nursing crunch for more than a decade now and working to expand programs and to ease the burden, as we know that so many are at or near retirement age. But obviously, COVID-19 has accelerated many trends that we've seen and challenges to our workforce, both at VA and in the private sector. Dr. Begley, if I could ask this question of you, a 2021 survey from the Kaiser Foundation found that nearly 60% of healthcare workers experienced a decline in their mental health due to stressors that they encountered in the course of their work during the pandemic. I heard about it firsthand from so many tours that I took of facilities in my district. I remember one nurse telling me, we were cheered as healthcare heroes at the beginning of this pandemic, but now I don't feel like I'm getting the support that I need. And in one tour of a local hospital just over a year ago, I remember nurses on the floor pulling me aside and telling me about how they were struggling, how they were seeking help for their mental health. Nearly 30% have considered leaving their profession altogether in that 2021 survey, and another survey by AHA's American Organization for Nursing Leadership found that one of the top challenges and reasons for healthcare staffing shortages was emotional health and well-being of staff. So I'm wondering, you talked about violence in the workplace and an important bill that we can support to help address that at the federal level. Could you expand on the findings of AONL's survey and what we should be thinking about as it pertains to the mental health of our healthcare workers?
Sure. Thank you very much for that question, Congressman. And that's actually my organization's study that you last referenced. It's a longitudinal study of all of our members, nursing leadership across the country. We had 4 different surveys over the past 4 years, or 3 years, excuse me. Some of those questions were the same, hence longitudinal, and others we added as new issues came up, over the course of the pandemic. The last survey was published in August. So our nurse leaders, and we surveyed managers, directors, and also nurse executives. They validated what you just said. Mental health and well-being for their staff was really their top challenge. This continues to be, and this is, I'm going to say that nursing is a proxy for the entire healthcare workforce. We learned, that some of the best practices in, connecting with our nursing staff, and I'm using nurses as a proxy, was really to communicate. There's no one size fits all. So what wellness programs work for one unit or one person may look different than, another organization. So that communication with your staff about what they need is really critically important. Last year, and thank you, Congress, for passing the Dr. Lorna Breen Act. That was an act and now law that provides federal funding for mental health education and awareness aimed at protecting well-being for healthcare workers. The important component, from my perspective, of that bill, in addition to the financial support, is really the idea that there should not be stigma in healthcare for seeking mental health. And that is something that when we look at all of our nursing leaders and leaders in healthcare, they talk very openly about, when you ask someone how they're doing, it's not just a cursory question, it's really, how are you? And in some cases, sharing their feelings and challenges with, what the last 3 years, has presented. So there's different ways. Mental health programs are critically important. We also need to increase access for behavioral health services to not only to our patients for sure, but also for our clinicians and our healthcare workers. And part of it is also reducing job stressors. And those, again, can be very, and we could probably take way more than our time here, but we could, when we look at what are some of the job stressors, staffing numbers are certainly part of it, but it's things like schedules that are do not fit with your work-life balance. We talked earlier about, moms and childcare and elder care, and how a 12-hour shift that has been pretty constant across our country for many, many years now may not be the way that I can continue to be a nurse and practice my profession, serve our country, and still take care of my work-life balance issues, my children.
Well, thanks very much for those comments and just what, the reflections on what our nurses are facing right now. If I had more time, I'd certainly ask the rest of the panel their thoughts. We know VA is working to address some of these issues, and we're hopeful to get additional feedback from you all. Thank you. I yield back.
Thank you so much, Mr. Pappas. And then Ranking Member Brownlee, would you like to make any closing remarks?
I will just be very, very brief. I think it's been a good hearing. I think we've raised most of the important issues and challenges. And, I will just say to the VA and to the management of the VA is that we all know that this is a crisis situation. It was a crisis before COVID. It's a bigger crisis now, and we have to treat it accordingly and work on this in a way that we can really expedite and And as the VA said, they have hired more people than they have historically in a long, long time. We just have to even do better than that. And I believe that we need the timelines and metrics so that we can do our proper oversight, but work with you to help us collectively get there. Thank you.
Thank you very much. And then I would like to thank everyone for their participation in today's hearing and for this productive, insightful conversation. One of my main priorities in Congress is to ensure our nation's veterans have high quality and timely access to care, as I'm sure my colleagues share that same sentiment. I took pages of notes. I want to just personally thank all of you for the job you all do every day in taking care of our veterans and our patients. There's so much room for improvement. I wish I could snap my fingers and make some of these changes that seem so easy. In my short time in Congress, I've learned that that's not quite how it works. So we will work together and see what we can do to implement some of the many changes that you all mentioned. I go back to my original sentiment of the reasons that nurses, but probably all healthcare professionals leave jobs. They're overworked and underpaid. So I think if we can work on how can we not take away some of that stress that many of you mentioned and not make you feel overworked, and then making sure we are properly compensating our professionals who take care of our veterans. I think those two things will go a long way. So I look forward to working on these issues with the department, stakeholders, and my colleagues on the committee. The complete written statement of today's witnesses will be entered into the hearing record, and I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material. Hearing no objection, so ordered. I thank the members and the witnesses for their attendance and participation today, and the hearing is now adjourned. Thank you.
Thank you. Good.
I appreciate it. Keep in touch. Yeah, that was good.